Good afternoon, everybody. Thank you for joining this Lunch and Learn today, which is on the subject of SOGO, which is the new Council Physical Activity year-long campaign. So just to let you know, we are recording this session. That's just so that we can share on our Council YouTube channel in future for other colleagues to be able to view the presentation. So the only other thing to say to you is we really do welcome questions. It'd be great to hear some feedback and some comments and questions, and there is the function to do that in the Q&A section that you just need to click on. Apart from that, we'll get going, and so I'll just introduce you to Sadie. Will be starting the presentation. I'll be taking over a little bit further on. So yeah, Sadie Walker is our Senior Public Health Manager for Leisure and Physical Activity. So Sadie, if you could take over.
Lovely, thanks Richard, and good afternoon everybody. As Richard said, I'm Sadie, and I'm just going to take you through some of the background of why we've launched the campaign and why now. If you could move on to the next slide, Sam, thank you. So firstly, what is Solihull on the Move? So Solihull on the Move is a framework that is based upon the principles of collaboration and partnership working to achieve positive outcomes for Solihull residents around moving more and being more physically active around sport, leisure and physical activity. The framework is underpinned by 4 key themes, of which they are active travel, active places, active society and movement is medicine. If you could move me on, thanks Sam. So why physical activity? I usually do this presentation to public health colleagues who are converted, so I thought I ought to put this slide in there in terms of why we're looking at physical activity. So sitting is the new smoking, so there's lots of work been done around reducing the number of people that smoke, whereas physical inactivity is still one of the leading risk factors for global mortality, accounting for 6% of deaths globally. People who are physically active have a 20 to 30% lower risk of cardiovascular disease, coronary heart disease and stroke compared to those who have a sedentary lifestyle. And what we mean by that is people who are not moving as much, i.e. sitting down. Regular physical activity is also associated with reduced risk of diabetes, obesity, osteoporosis, certain cancers, and is linked to improved mental health. In particular, in older adults, physical activity is associated with increased functional capacities. So what we mean by that is by an older person being more physically active, they're less likely to have a fall at home. Therefore, they're less likely to come into hospitals or come into the care system and are able to be at home a lot longer. If you could move on for me, thanks, Sam. So using the Q&A function, I'm just going to read out a couple of statements and using those percentages that are in front of you that you can see now, if you could just type in the Q&A which one you think refers to the statement that I'm saying. So the first one is going to be, what percentage of adults in Solihull are classified as overweight or obese? So in the Q&A function, if you could pick out one of those figures that you can see. Don't worry, we're not going to see who's saying what. Have we got a few coming in? Anyone want to give it a go? It doesn't matter if you don't want to. Okay, so the number is 62.8% of adults in Solihull are classified as overweight or obese. So the next one I'm going to ask is adults that are physically inactive. So by inactive, we mean that they do less than 30 minutes of moderate intensity per week. So which number or what percentage, thanks Tom, so what percentage do we think in Solihull of adults that are physically inactive, so they're only doing a maximum of 30 minutes of intense exercise a week? Okay, so the answer to that one is 24.3, so a quarter of the population in Solihull adults are physically inactive. So I'm just going to pick out one more because this is related to physical inactivity. So what percentage of adults report a long-term musculoskeletal problem in Solihull? So that's what percentage of adults report a long-term musculoskeletal problem in Solihull. So what percent do we think that's going to be? So in Solihull, it's 18.9%. So that's a fifth of the adult population say they report a long-term musculoskeletal problem. Now you're probably thinking, why are you asking me about overweight adults and adults that have got an MSK issue? And the reason is because these are things that if you are physically active, these are some of the things that can be helped or prevented. Likewise, also hypertension, depression, mental health, and some of those other things I mentioned earlier. And it's really interesting for us in Solihull to monitor these figures so that we can see if any of the interventions that we're putting into place have an impact on the population in Solihull. Okay, thanks Sam. If you could move me on to the next slide. So SOGO, the campaign itself, takes inspiration from the Birmingham 2012 Commonwealth Games. It encourages residents to take simple steps to improve levels of activity, and in turn this will benefit their physical health, mental health, well-being and community connectedness. There is lots of evidence which demonstrates that major events such as the Commonwealth Games inspire the public to get active with some level of engagement. Therefore, it's an ideal time for us as a collective to get Solihull residents moving and active, capitalising on the back of the Commonwealth Games. We've been working in partnership with a local marketing agency called Big Cat on the development of the creative campaign SOGO, and following market testing, SOGO was the preferred campaign creative. Phase 1 of the campaign launched on Monday, the 26th of September. I'm now going to pass you on to Richard, who will go through the campaign concept, the website, the toolkit available, and what phase 2 is going to look like. Thank you.
Thanks, Sadie. So yeah, just continuing onto the next slide, if we could, Sam. Great. So as Sadie just said, we recently launched. We launched a couple of weeks ago, and we've launched with quite a we've launched with effectively a soft launch, with a stronger sort of more powerful launch coming a little bit later in November, which I'll talk about in a minute. So what is the strategic concept all about? What we're trying to do is really show residents of Solihull that this campaign is for them, and to show, as it says there, benefits beyond the physical ones, because one crucial link between a really important link with physical activity is the link to mental health and to that sort of well-being and feel-good factor. So there's a key link between people who exercise and an improvement in their mental health, and that is a really, really important part of the campaign. So what the graphics and the visuals that we've created so far show is different types of people, different age groups, because the campaign is for everyone, in different sort of physical activity situations, with an example just there, and just with some messaging that that is meaningful in terms of trying to encourage people to get active. So as I'd said, SOGO is a campaign for everyone. It's not just aimed at a certain age group, it's all ages, all abilities. So for example, if people don't move at all, we want to encourage them to start thinking about and doing activities, even just starting off with something very small and just something very simple, which could be as simple as something like gardening activity. It hasn't got to be some strong physical activity or sport. And as I've said, it's really for everyone of all abilities, and as well, it's not just for fit and active people. It really is an all-encompassing campaign to include all residents of Solihull. We are working with our partner organisations as well to push the message out. With their help, it can really make a difference for them to engage with the campaign and talk to their members about the campaign. And we're asking them to do that through their own sort of communication channels. Okay, Sam, on to the next slide, please. So here we have, as part of the campaign, or linked into the campaign, we have launched a new Solihull on the Move website with a dedicated SOGO campaign page. An important aspect of the SOGO campaign page is there's the ability to actually to sign up to the Toolkit. Now, a Toolkit is something that we've spoken to our partner organisations about quite in quite a bit of detail. The Toolkit includes social media assets to encourage that sharing mentality. So when partner organisations sign up to the Toolkit, they get access to download certain assets to spread the word. So what I would encourage you to do is any clubs, organisations, groups that you're aware of, please do spread the word to those groups. They can then, as I say, download the assets and start sharing on social media, which is something that will, for phase one, really start to get the message out about SOGO. On to the next slide, please, Sam. One thing I should have mentioned just a moment ago is SOGO. We've got a SOGO hashtag as well, which is literally, thanks Sam, is literally just hashtag SOGO, nice and simple, that we're asking the partner organisation to share to get some momentum on social media. That's great, Sam, thanks. So I've just spoken about the Toolkit. It's a really simple document that really just also does actually, apart from the downloads, does explain and sort of reiterate what the campaign's about. So the great thing about the Toolkit is it just creates what we want to do, what we want the partners to do, how we want them to spread the word, and how to do it. So it's a simple what, when, where, and how. So like I say, if you can certainly spread the word about signing up for the Toolkit to any partner organisations you're aware of, or any groups. And simply to do that, all people need to do is to go on to solihullonthemove.co.uk, and you can sign up quite simply there just by providing your email address, and then you get the link to the Toolkit. That's great, Sam. If you can move on to the next slide. So yes, in terms of phase two that I mentioned before, so at the start of November, we'll be launching phase two. The reason we are phasing the launch is because we were keen to launch the campaign, as Sadie said, as soon as possible after the Birmingham Commonwealth Games, to have that energy and that inspiration from the games. But phase two will really take us to another level in terms of starting to talk to more groups and more people and really engage more. And we'll be doing that. Could you just go on to the next bullet? Yeah, that's great, Sam. We'll be doing that via using some really sort of brand new imagery that we've just been had photo shoots for recently, because we'll be having imagery that really shows Solihull people in Solihull locations, and that aren't stock images that we've used originally. So yeah, and really those images are of real people. They're not of people sort of looking like elite sports people. It's just showing people some examples and ideas of what they can do, And again, it covers all the age groups and the demographics that that show that SOGO is really for everybody. So where will you see this imagery and this advertising and promotion? We're currently just organising the second phase of the campaign at the moment, but you are going to see when you're out and about in terms of outdoor media, we're looking at sort of bus advertising. There'll be social media activity which will continue, some paid for social media activity, and also some digital radio activity as well across a number of different radio platforms. So we're very much hoping, and we're confident this will be the case, that you'll be out and about in Solihull and you will hear and see about the campaign. So there should be lots of reminders using the branding that we've just shown you with brand new photography and imagery. That's great, Sam. On to the next slide. I think it may, oh sorry, yeah, there was one. The last little bit was there's certain parts of the year, because this is a year-long campaign, that we want to really sort of spike and push the awareness of the campaign. So we're looking at promotional spikes using some of the methods I mentioned before in terms of digital radio and outdoor advertising during those periods of time, sort of January, the start of the year, which is a very important time. I think we're all aware after Christmas, where people start thinking about wanting to get moving, and we can really capitalize on that, on people's appetite to make a difference after Christmas, and then also in the summer of next year as well. That's great, Sam. Thanks. Next slide. Back over to Sadie, please, Sam.
Thanks, Richard. So this is the last slide around measuring impact. At the minute, we're measuring this on a weekly basis because it's the first campaign of this size that we're doing in my team in particular. So we want to certainly measure where things are working and where things aren't, and so we can do something about that a bit quicker. So yes, attendance is on some of our programmes and events, but that isn't the be all and end all. Although our programmes, events and sessions are part of this, it's the wider sector in terms of physical activity, sport and leisure that we want to impact on as well. Number of downloaded toolkits and by which organisation, that will allow us to target certain organisations that maybe haven't got involved in it in terms of best use of the team's time, and then some web page stats, some social media stats that we're collecting on a weekly basis. It's also worth adding, linked to some of the numbers that I mentioned earlier, is the long-term impacts on this. So being in public health anyway, we measure on an annual basis through the public health outcomes framework certain measures around activity and prevalence of long-term health conditions. So we will be capturing that as we're doing anyway. Also case studies and stories. So we're looking to commission a piece of work where an organisation will be going out to some of these organisations and some of these sessions to capture how people feel about this on the ground as well, so that at the end of the 12 months we'll have a nice story that we're going to be able to tell around the year-long campaign of SOGO. And that is everything from me. I think we're going back to Richard. Thank you. Richard, you're on mute.
Thanks, Sadie. It was all going so well. One thing I just wanted to mention that I'd not mentioned earlier was in terms of launching the campaign, we've launched it both internally within the council, but also externally. So, for example, you may have seen the leader talking about SOGO. You may have sort of seen some internal messaging from Nick, for example. So again, it's something that is been really highly promoted within the council and externally as well, due to the importance of the campaign that is for a full year. So just going back to the questions, Let me just have a look. If anybody, I know you've answered, sort of some people have commented on what Sadie had said in terms of those percentages. Thank you for being involved there. If there's any other questions, please put them in the chat. I'm just looking in the Q&A. I'm just seeing if there's anything else at the moment. Don't think we've got any questions at the moment, but feel free. Oh, no, so feel free to put a question there. Oh, Tom's just dropped one in. Let's have a look. So Tom, what have you said? Have you considered the images to have QR codes for people to scan just for convenience, that can go straight to the website or targeted section of the website? It's a good question. We haven't done that so far yet, Tom, but we will be doing that for phase 2. As you say, it's something that's quite prevalent these days, just to make it easier for audiences. So yes, we plan to do that with certain comms channels and with certain assets as well. So yes, Tom, thanks for that. If there's any other questions, please feel free to post. We'll just leave it another couple of minutes if there aren't any other questions, and feel free to ask questions about anything about maybe the any sort of types of activity that you think we should be encouraging. There's lots of different activities that we will be sort of recommending, but just because we don't talk about certain activities, it doesn't mean that it's not something that people should do. So we will be really encouraging people via sort of hints and tips as to things they can do themselves that may not be sporty. And because this is really a campaign for everybody, there may be people that can't leave their homes, and we'll be providing sort of hints and tips and ideas for exercises in the home as well. So it really is not a campaign that's aimed at sporty people. It's really sort of encouraging people to try and do something and be inspired. So no further questions yet. So I think I'll give it another 30 seconds, but I think we'll probably wrap it up there if there's no questions. So yeah, just to finish off, thank you for everyone for joining. But just before we go, I just wanted to flag up the next Lunch and Learn, which is in November, which is on the subject of the integrated care system, and is at the end of November, on the 23rd of November at midday. So look out for that being promoted, and please sign up if you're interested in joining that. So that's it for today, everybody. Thank you very much for joining. If you have any further questions, we can take those. We can pick them up in the chat afterwards, and this video will be going onto YouTube, so please encourage anybody that's not joined today to have a look at that on YouTube. Thanks again. Thank you very much.